G'day everyone. Thanks for joining me today as we dive into a topic that affects millions of people around the world, yet is still surrounded by a lot of confusion and even stigma. Today we're talking about something common but often misunderstood: menstrual pain. Whether you call it period pain, cramps, or just that time of the month, it's something most women and people who menstruate will experience at some point in their lives. For many, it's a regular part of life, ranging from a mild ache that's easy to ignore to severe disruptive cramps in the lower abdomen that can stop you in your tracks. Sometimes it's just a dull, nagging pain, while other times it can feel sharp and intense. Medically, this is called dysmenorrhea, and it can make daily activities tough. Imagine trying to focus at work, school, or even just relaxing at home, while your body is sending out constant pain signals. The pain comes from the uterus, which is actually a very strong muscle. During your period, it contracts to help shed its lining, and these contractions can cause pain, just like how your legs might ache after a tough workout. But unlike sore muscles, this pain can be unpredictable and sometimes much more intense. The intensity of menstrual pain varies a lot from person to person, and even from one cycle to the next. Some people might barely notice it, while others find it completely overwhelming. It can also change with age, stress, or other health conditions. For some, it's a mild throb or a gentle reminder that their period has arrived. For others, the pain can radiate to the back and thighs, making it hard to move or even get comfortable. It can come in waves, or feel like a constant ache that just won't go away. It's important to normalize talking about this. Menstrual pain is real, it's valid, and it deserves attention. No one should feel embarrassed or alone when dealing with it. Most women will experience it at some point, and sharing information, tips, and support can make a huge difference. When we talk openly, we help break down the stigma and make it easier for everyone to find relief. Understanding your body is the first step to finding relief. When you know what's happening and why, you can make better choices about how to manage your symptoms and when to seek help. In this chapter, we'll break down what causes menstrual pain, the most common symptoms to look out for, and some practical things you can do to feel better. We'll also touch on when it might be time to talk to a doctor. Let's get started and empower you to take control of your cycle so you can feel confident and supported every month. So what causes menstrual pain? The main culprits are chemicals called prostaglandins. These messengers trigger the uterus to contract and shed its lining if pregnancy doesn't occur. More prostaglandins mean stronger, more painful cramps. These contractions can also reduce blood flow, adding to the pain. Prostaglandins can travel through your bloodstream, causing symptoms like nausea or diarrhea. That's why period pain can feel like a full-body event. Many pain relievers work by blocking prostaglandin production, reducing cramps. The process is natural, but you don't have to suffer. There are ways to manage it. It's about making your period more manageable, not stopping it. When it comes to menstrual pain, doctors generally classify it into two main categories: primary and secondary dysmenorrhea. Understanding the difference between these types is crucial for managing your symptoms and knowing when to seek help. Primary dysmenorrhea is by far the most common type. It's caused by natural chemicals called prostaglandins, which trigger the uterus to contract during your period. These contractions can lead to cramping pain, but there's no underlying medical condition causing it. This type of pain usually begins within a year or two after your first period, often affecting teenagers and young adults. Many people notice that primary dysmenorrhea improves as they get older, and it often becomes less severe after childbirth, possibly due to hormonal changes or changes in the uterus. Typically, the pain starts just before or at the very beginning of your period, sometimes even a few hours before bleeding begins. It can last anywhere from a few hours up to 3 days, and is often accompanied by other symptoms like back pain, nausea, or headaches. Secondary dysmenorrhea, on the other hand, is different. This type of pain is caused by an underlying medical condition, such as endometriosis, uterine fibroids, or pelvic inflammatory disease. Unlike primary dysmenorrhea, secondary pain often gets worse over time and may become more intense with each cycle. The pain can start earlier in your menstrual cycle, last longer than 3 days, and may not go away with typical home remedies. If you notice your pain suddenly changes, becomes much more severe, or stops responding to treatments that used to help, it's important to consult a doctor as soon as possible. Recognizing the difference between primary and secondary dysmenorrhea is key to finding the right treatment and improving your quality of life. Don't ignore new, persistent, or worsening symptoms. Tracking your pain and other changes can help your doctor make an accurate diagnosis. Early diagnosis and proper management can make a significant difference, leading to better outcomes and a more comfortable life. The most recognizable symptom of menstrual pain is cramping in the lower abdomen, which can range from a dull ache to sharp, intense spasms. These cramps often start just before your period begins and may last for several days, sometimes making even simple movements uncomfortable. But the discomfort doesn't stop there. Menstrual pain can affect much more than just your stomach area. Pain can radiate to the lower back and even down into the thighs, creating a deep, aching sensation that makes it hard to find a comfortable position, whether you're sitting, standing, or lying down. Sometimes the pain is so intense that it's difficult to sit or stand for long periods. Digestive issues are also common. Nausea, vomiting, diarrhea, or constipation can all occur, thanks to hormone-like chemicals called prostaglandins that affect your digestive tract. Many people also experience fatigue, headaches, dizziness, and bloating. These symptoms can leave you feeling drained and uncomfortable, making it tough to get through your usual routine. It's not just physical. These symptoms can disrupt your daily life, making it hard to concentrate at work, school, or even during simple tasks at home. Emotional effects are also a big part of the experience. Irritability, mood swings, and sudden bursts of frustration can appear out of nowhere, making interactions with others more challenging. Anxiety and feelings of worry or unease are common, and sometimes you might feel more sensitive or emotional than usual. Living with recurring pain and these emotional ups and downs can be exhausting, both physically and mentally, especially when it happens month after month. Recognizing the full range of symptoms, both physical and emotional, can help you manage them better and seek the right support when you need it. Be kind to yourself during this time. Practicing self-care, resting when you need to, and listening to your body are all important steps. Remember, it's a package deal, but you don't have to face it alone. Reaching out to friends, family, or a healthcare provider can make a big difference. Understanding your symptoms and tracking them over time is the first step to finding relief and feeling more in control of your menstrual health. While you can't always prevent menstrual pain, healthy habits can help reduce its severity. Regular exercise, like walking, swimming, or yoga, boosts blood flow and releases endorphins. A diet rich in whole foods and low in processed foods may reduce inflammation and cramps. Magnesium-rich foods, leafy greens, nuts, seeds can help relax muscles. Staying hydrated is key. Managing stress through mindfulness, hobbies, or good sleep can also make a difference. Some supplements like magnesium or omega-3s may help. Ask your doctor before starting any. A proactive approach can make your period easier to handle. You don't always need medication to ease cramps. Simple home remedies can help. Applying heat with a hot water bottle or warm bath relaxes uterine muscles and relieves pain. Gentle movement, like stretching or yoga, can reduce tension and improve blood flow. Herbal teas, chamomile, ginger, or peppermint, soothe cramps and nausea. Rest is important. Listen to your body and take it easy when needed. Lying on your side with knees up can relieve pressure. Combine rest, heat, and deep breathing for maximum relief. These small rituals can make a big difference. Self-care is essential during your period. Find what works best for you and stick with it. If home remedies aren't enough, over-the-counter NSAIDs like ibuprofen or naproxen can help by blocking prostaglandins. Take them at the first sign of cramps for best results. Hormonal birth control, pills, IUDs, patches can make periods lighter and less painful. If pain persists, see your doctor for stronger medications or other options. For secondary dysmenorrhea, treatment targets the underlying condition, sometimes with surgery or specific therapies. Don't hesitate to seek medical help if pain is severe. There are effective solutions for every level of pain. Relief is possible with the right approach. Know when to seek help. If pain disrupts your life or doesn't improve with home care, talk to your doctor. Sudden changes in pain, longer-lasting cramps, or new severe symptoms are red flags. Keep a diary of your symptoms, pain levels, and what helps or doesn't. This information helps your doctor diagnose and treat you effectively. Don't be embarrassed. Menstrual pain is a legitimate medical issue. Doctors can offer exams or tests to find the cause and best treatment. Asking for help is a sign of strength, not weakness. You deserve to feel better. The key takeaway: listen to your body and don't accept severe pain as normal. Track your symptoms and patterns to advocate for your health. Start with lifestyle changes, home remedies, and over-the-counter relief. If that's not enough, seek medical advice. There's no need to suffer in silence. Remember, you're not alone. Millions experience this every month. Talk to friends, family, or partners for support and understanding. Sharing your experience can help and reduce isolation. If you support someone with menstrual pain, offer empathy and practical help. Early diagnosis and treatment make a big difference. Take charge of your menstrual health and support each other.